I am Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this morning we're discussing case number 00149, a 15-year-old domestic shorthair. This is a retest with a history of UTI and vomiting, and the treatments have been, we've used cold laser for the trigger points and amoxicillin antibacterial. Current therapies, we're using Atopica for skin issues and inflammation. And what was weakened was allergies, and stressed was cell metabolism, and the endocrine system in this case was pituitary and pineal. And how it laid out on the past and current therapies or current test results is that past test result we had a circulation issue which was weak at 45 and it balanced at 51. The heart was 46, it balanced at 53. And cell metabolism was balanced last time, but it stressed at 56, where 55 is normal, so not too bad. 55 is where we want to be, so just tip the scale. Cell metabolism is all the metabolic processes that go on within the body, within the cellular network. So the Krebs cycle, oxidative phosphorylation cycle, those kind of processes that produce energy to make the cells work, and if they're slightly weak or stressed, then the body doesn't produce the necessary energy that it needs. And so that's what cell metabolism is talking about in this case. Stomach was weak and it went to balance. The adrenal was at 46, it balanced at 51. The pituitary, which is the sensory circuit, if we look at the information that goes in as our five senses, and the pituitary is in the hypothalamus of the midbrain, and it's receiving this information. And when that is stressed, then it can send a stress signal into the body, or if it's a weak signal or weak test result, it can send a weak signal into the body, and that's important. So, but we did go from weak to stressed, which means that we've responded. So that's, even though it's a stressed result, we went from a weak signal to a stress signal, which is better. And then allergies of the lower part of the body, or toxins that accumulate in the lower part of the body, was at 48, which was balanced last time, and then we went to 45, which is slightly weak there, where 46 is normal to 47. And so, at least in the short term, we always want to use the hemp oil infusion for treatment. We're going to infuse for the AL1, which is toxins of the lower body, the cell metabolism, and the pituitary and pineal. So we've got this as our infusion, and we want that for 3 drops for 3 months. 3 drops per day. So that conditions, so brings these numbers back into condition. We did a really good job over here. We're seeing just a couple, just 1 weak point now and 2 stress points, so we're getting there. And there is a couple of things that we can consider, because cats aren't notorious, or are notorious, I should say, for not really liking medications. And so Young Living essential oil, and the one called Awaken would be a good choice, or Thieves. And essentially you use just a toothpick into the oil and then just rub it down the back, and that provides the energy on a daily basis to correct those conditions as well. It's more of a supplement to the environment to help with recovery, and do that daily for 3 months as well. And so those two, I think Thieves is probably a better choice. I like because it was more related to the pituitary, which we want to condition a little bit more. So I'm going to choose Thieves. We'll have it in our store, and we'll check availability right now and give you a call on that. And then the hemp oil we'll have infused for you if you haven't picked it up right away already. Then we'll have it for you when you pick it up. And so if you have any questions, 847-541-4005. or shoot us an email at groveanimalhospital@gmail.com for anything that comes up in between. I like to see patients typically every 3 months, and then kind of checking in monthly if everything is going well. She's done really well, you know. At 15, this is more, there's geriatric conditions and more maintenance related to keeping them functional and healthy at this age. So, but if questions come up in between, let us know. Thanks so much.